Hello, friends. Susan Axelrod here, the Confidence Coach. I am coming to you live today to host a conversation in the Confidence Zone with my friend and colleague, Evie Lennon. She'll be joining us in a minute or two. We have rolled out and launched a monthly discussion on the topic of chronic conditions. Evie is the author of an amazing book that I cannot recommend highly enough, which is Drawing Comfort for Chronic Conditions. I met Evie online. I can't really remember how, and we got to know each other. And I bought the book because I wanted to support her as an author. I started reading the book because I wanted to support her. But after a page or two, I finished reading the book because I was learning about something that is so powerful and so important and so prolific that I realized it pretty much touches every single person. The topic is chronic conditions. Now, often chronic conditions are about illnesses, disability, medical issues, etc. Sometimes when we hear about a chronic condition, we think about an autoimmune disease, etc. In my work as a coach, I have learned through my work as a trauma-informed professional coach, I have learned that chronic conditions are much more prolific than that. Our mind and our body can be affected by chronic conditions. At this point, nearly every day in my work as a coach for women in the second half of life, although I have many coaching clients who are younger, not in the second half of the life, and I also have several men clients as well now. Nearly every day, I finish my calls, or at the end of the day, I'm counting my blessings. I'm thanking God for the strong foundation of my life. And I often share and reveal that I've had my own bouts with anxiety and depression. I did go on medication for 7 years. I did work through therapy and physical activity, etc., to get off of medication. And but I'm learning more and more that these types of issues really can be considered chronic conditions. And that's why personally it spoke to me. And that's why I wanted to have these monthly conversations with Evie Lennon. So Evie is here now, and I'm delighted to welcome you. Hi, Evie. Thanks for joining
Hi, I am so excited.
Well, I wanted to just get on and share a little bit, a minute or two before you got here, about what this conversation is, how we know each other, how we got started. I already talked about your book, and I said this. I bought the book to support you. I started the book to support you, but after a page or two, I finished it to support myself and so many others. So I really want to say that knowing that you have your own issues to deal with, that you pushed through and you finished this book. You know, I work with authors all the time, as you also know. So to not only get through it all, but to finish it and get through the publishing of a book like this is absolutely fantastic. So thank you, friend, on behalf of the world.
Well, thank you.
So today, there's a few things we wanted to talk about, just to let our listeners know and our viewers know this is not a scripted conversation. It's totally extemporaneous. But I did say to Evie, she is the expert on this. She is the Chronic Conditions Chaplain. And so when I asked you what you might want to speak about, you told me that you would like to speak about the spiritual dimension of illness. and how to support and honor people on the journey. So is this still what's uppermost on your mind, or has something else come up for us to discuss?
This has very much been on my mind. It's been front and center for me, just in talking with other people who are on this journey. So
let's do it.
Okay.
So let me ask you, what I was just talking with my friend this morning about the translation of words. What is it that you mean? What's on your mind about the spiritual dimension of illness or chronic conditions? How has it been showing itself to you? What are we talking about here?
I think that an open mind is the most important thing. A lot of people talk about openness to wellness, which is extremely important. There's a great book called Love, Medicine, and Miracles by Bernie Siegel. He's a surgeon and doctor who works with cancer patients, and he started noticing common denominators among patients who survived. Some people who had a terrible prognosis and survived, other people who may have not faced a lot of difficult odds, but still didn't, become victorious in terms of life and death. And at the same time, I'm sensitive to the language that we use. And recently I listened to a wonderful podcast with Diane McClay, who you introduced me to. And
Diane McClay is the Choice and Courage coach, and she's with the KS Media Group app, and her company is called the Choice and Courage Company. Happy to give that shout out to our friend. Yeah, go ahead.
Yes, she really made an impact on me with just one sentence, which is usually what it is that, sticks in our brain. But there was an interesting conversation with Cindy Lynn and Stephanie, and Diane pointed out that our word choices are really powerful, and it's really important in terms of people's healing and how they feel perceived, that we use language that creates a space for a person to define the meaning for themselves. And I would say probably the greatest pitfall is that when we're talking about class, or if we're talking about wellness versus illness, that's not such a black and white category. If you're white, you can't become Mexican. If you're black, you can't become Asian. We're in these categories. When it comes to wellness and having a chronic condition, sometimes people can achieve wellness. Sometimes if someone is poor, they can achieve a higher status.
Yeah. This is interesting. I just want to interrupt for a second, because in my introduction, I actually talked for a second about that I have a changing paradigm, but per exactly what you're saying, it's really about the words, because when you think of a chronic illness, it's an illness. You think of a chronic condition, it's something that's sort of medically, physically health related. But in my experience as a coach working with my clients all the time, I'm seeing chronic conditions show up in mental ways, emotional ways, spiritual ways. And it really is all about what you call them. So it's interesting that when I say, what do you mean by spiritual? And you talk about something I call words matter. That's my paradigm for it. Words matter. And the way the words we use actually lead to is it like it leads to your own personal spiritual outcome of how you see yourself and what your experience is?
Good question. And this is why I love talking with you, because you always bring it to a center point. I think that there's an equation that can work one way, but we sometimes think it can be reversed, and this is what I mean. There are people who say, I chose not to be sick anymore, or I decided, and it spans many different faiths, walks of faith. It can be a very fundamentalist Christian faith that says, I don't claim this. I'm blessed and highly favored. It can be a very metaphysical standpoint that says that we are spiritual beings and we live in these physical bodies. And I think where it gets tricky is I think about my time as a pediatric chaplain, and I think about babies who are sick. Or I think about a 7-year-old who I just learned about. He didn't make it. He donated, I believe, 5 of his organs.
Oh.
And so it changes the language that I use. And so I've been thinking a lot about sometimes in our eagerness to help somebody heal, in our eagerness to make sure that that very powerful component of psychological and spiritual well-being, which totally impacts our health, no matter if we're the most fit person or, if we're on death's door, that has a huge impact on our health. And I was thinking about a couple of people. One is a man that I was at an adult hospital, actually, and he was on a hike with one of his friends from church, and he began to have heart issues, and they were deep in the woods. And his other friend said, "Hey, I've got a cell phone. I think we really should call for help." And he said, listen, I'm going to pray about this. I'm going to be fine. And it's important to have faith. And at the same time, by the time he did get help, he only had 10% of his heart function left. So it becomes a huge responsibility when we're talking to people about their spirituality and health. And I was thinking about something, I wrote this down. I think sometimes we make an assumption that if a person gets sick, their spirituality or their psychological health has not been important enough. There is a privilege in wellness, but it's tricky because sometimes if you take certain steps, you can increase your health. There's a certain privilege in class, but it's tricky because if you take certain steps, sometimes you can achieve more economic stability. But for me, what really blew a lot of things out of the water for me was being in a pediatric setting and meeting people who were much more evolved than me, who looked me in the eye and said, "I am walking out of this hospital with my baby." And so when that doesn't happen, and you start to see that, if they're doing ministry with homeless people, sometimes that person on the street corner knows more about resilience than I do. And so I think there is a lot of shame. I'll just say this, and then I want to hear from you. I think there's a lot of shame in being sick because there's a lot of fending off of, oh, you may be off track, or, and so I think saying to people who are sick, your mental health and your spirituality, the meaning you make out of life, how well you take care of yourself is more important than ever, is really different than some questions that I was on the receiving end of is, what ways have you not been making it important enough? And those are it's a same goal, but it's different
Right?
words.
Different
Words
perspective.
matter, like you said, and you brought that home.
Yeah, this is really like both really deep and also really big. Those are two different things. And when you get into the true spirituality, somebody in the woods says, is having heart problems, concerns, and they say, well, I'm going to pray to God, even though the other person has a cell phone and cell access, that's pretty deep. The old joke as it goes, where the person, didn't take the signs and ends up at the gates, and God says, well, I sent the rowboat, I sent the helicopter to you, right? That's really
Right.
what sort of that's about. Like, what is your, it's interesting. You went really deep into spirituality there, and what is your faith? And somebody looks you in the eye and says, I'm walking out of here with my baby. There's such a deepness of faith, if nothing else, like I have to close my eyes when I say this, if nothing else in that moment, that parent can feel the faith supporting them. Later, the end reality might be different, but faith can support you in that way at that
Mm-hmm.
time. The bigness is the spiritual sense of how we see ourselves. I'm not sure if I'm getting this right. I can ask you how we see ourselves, how we show up, words we use, uh, the impact that being in faith, having a spiritual outlook in life, being committed personally to yourself, how that can serve you,
Mm-hmm.
even with whatever your chronic situation am I getting it? Is that
Yeah, I think so. And I think it is really easy to, as because we are healers, we're in the healing profession. We want to encourage people. Um, and it is, I think it's because this may be true um, for individuals. There was a woman I mentioned in the book, Anita Morjani, who wrote a book, Dying to Be Me.
right?
She had the near-death experience, and she, you know, ended up being completely healed of stage 4 cancer on death's door. And it's kind of like straddling a line of holding out for possibility. And and she talks a lot in her book about how we can support people, and and you know how we, or let me just back up and say, I think that no one can define for somebody else, which is something I've never seen you do, why that might be happening to
Mm,
this person, because we don't know. There may be a baby who's a bodhisattva, who's achieved nirvana and has decided for whatever reason to spend 3 years here.
mm.
It may be that baby, that toddler, could be more evolved than we can dream of. So I think one thing I encountered as a patient is an assumption that I must be less evolved, or I may be behind. And that may or may not be true, but how we help somebody make meaning, how we help somebody find the wisdom that is in every situation, um, is important.
I mean, this is so deep. I was just talking about this today with someone. I have my own experiences. I come daily as the confidence coach in the confidence zone, but that doesn't
Yeah.
mean that I'm supremely confident all the time. I have my own personal experiences. Why have I had them? Why is this happening to me?
Yeah.
It could be said something I'm experiencing is sort of a chronic condition of a
Mm-hmm.
sort. If I didn't, it could lead to an emotional chronic condition if I didn't have tools and commitment
Absolutely.
and my own deeply spiritual experience to figure out what is intended for me, myself, like you say, the 3-year-old who achieved nirvana. Boy, this is we're back in deep where I just hold on a second. I really want to connect these dots. Okay. So when we're suffering, we're suffering. When we're suffering, then we're suffering. And in the suffering, we disconnect a little bit from soul because we're what? Suffering.
Mm-hmm.
But what you're bringing forth today in this conversation is the idea of the spiritual dimension of illness or the chronic condition as we're talking about it, and how we can sort of take, maybe, if I'm not sure if it's the right word, take responsibility in that way to support ourselves and or somebody we
Mm-hmm.
love.
Mm-hmm.
Is did I connect dots there from the reality of living with a chronic condition and the spiritual dimension that you can apply or go through?
I think so. Tell me more. I mean, I like where you're going. I
Yes.
mean, because
So,
I'm learning from you as well. And
well, it's funny. That's actually what this conversation is about. It's why we decided as a result of our podcast about your book, it's why we decided to have this ongoing conversation.
right, I'm always like mind blown, like, oh, like a whole new room. It's those dreams you have where you have a whole nother room in your house that you didn't know
Yeah.
about. I don't know if you have those, but
Yeah.
that's
And
what talking to
also,
you is like.
right. But for me, it's the same because I honor and respect that, your personal circumstances. And I'm learning, words do matter. I'm learning now we're talking about a spiritual dimension to facing your illness, to dealing with your illness, to grappling with your condition, to living with the condition. And for me, I sort of, you're so out of control. You're really so out of control. You and I have talked about this personally many times with your situation or my situation, right? We're both human.
Yes.
We have these situations, and the feeling of being out of control is so obvious and easy and clear. And then, but by going using this spiritual dimension that you're talking about, by being in that dimension, you can rise a little bit in your control. As
Mm-hmm.
long as you sort of indicated you keep it in the world of reality. The guy with the heart attack in the woods, it's like, let me make a call, please. But it's interesting. We focus on the mental dimension, the emotional dimension, the physical dimension. But here today, you've brought forth the idea of the spiritual dimension of illness or chronic condition.
And I think it's not easy because we're holding a set of contradictions. It's like, walking that tightrope of possibility. And, I've been thinking about another question, which is, is a diagnosis a good thing or a bad thing? Is that liberating or is it confining?
I mean, I think that we have to have a whole conversation about that next
that's a whole nother thing. Yeah.
That's a big conversation. The idea of labels, the idea of liberating or confining. I want to talk about that next time because there's so many people I know who do know and say they're defined by their illness, but yet we also know people who have broken through and are no longer, in quotation marks, defined by that label or that condition that was put on them. From this perspective today, though, I still think, even as we lay up our next conversation, the third Friday of the month at 1 p.m. Mountain Time, noon Pacific, 3 p.m. Eastern, then there's still, even it's the spiritual dimension, it's the spiritual outlook, it's the outlook of faith, whether it's in oneself or God or the universe or whatever somebody's faith orientation is, that even allows you to begin to rise up, to look at the question that we'll grapple with next time. Are you your diagnosis? Of course, Cindy Lynn also talks about that. But I think that honestly, in your willingness to share yourself and in my willingness to reveal my own struggle, in my case with depression and anxiety earlier on, or emotional concerns that I have now, or whatever, I think that we are equipped to have that discussion as well. I want to just thank you for really bringing this idea of the spiritual dimension, because oftentimes when somebody's in a chronic situation, there is no spiritual outlet. There's just no spiritual sense ability anymore because of the difficulty.
And, and I think that, the probably one of the biggest issues people have sometimes when they do get sick is a sense of shame. If they're a parent, they're like, have I done something wrong? And I think it's important that our words simultaneously hold the possibility of finding solutions and treatment plans that work, that give us our life back, whether that's energy, our physical life.
Right.
And at the same time that we don't subconsciously make an equation that wellness, that if we made it over to this land of wellness, that we use language that doesn't imply that when you become spiritually evolved, or when you eat right, or when you do this, you will be well, because there's certainly people I met that had amazing health regimens that were, only ate corn that was grown in the middle of a land, that still had pancreatic cancer. So I think that when we offer of space, as you have done with me quite successfully, you are a healer through and through.
Thank you.
And it had a huge impact on my peace of mind and my possibilities. And when we open that space, that we not make that assumption. I guess I've been thinking about patients a lot. People that I've known, and people who I considered farther along on their path, not that we can ever really judge that. And so I'm humbled to still be here. And I think that it's tricky because we have this minority status. If you're disabled, then you have a minority status.
Well, let me say we're just about out of time. Yeah. So I want to thank you for your willingness to share and discuss. You are the expert, and I've learned from you. I actually have expertise also, even though I didn't know it, because the truth is that we all live with this a little bit. But that should also guide us and lead us to have that open mind, the open-mindedness with the way that we look at others, because we really truly never know, what the story is, under the story, as I say. So thank you, Evie, as always. We're going to have a good discussion next time. The third Friday of March, we will be convening again, and I will look forward to it.
Yeah, me too, my friend. It's very good to see you.
You too. See you soon.
Bye.
Take care. Bye-bye.